Right, that's great. And as you can see, Alan there was pre-recorded that. So apologies for cutting off his top. It's midnight, past midnight in South Africa, but brilliantly, Alan has stayed up and ready to answer your questions, which have come straight in already. So let's take them from the top here. So the first one, what are some of the successes and challenges Phage has had in engaging with community stakeholders across the working groups? That's a very broad question, Alan. I guess if we turn that around, what's surprised you about what's gone easy and what's been difficult for Phage?
Yeah, so thanks very much. And so with the range of working groups that we have, I think probably the first point is really around the engagement among working groups. And so I think we certainly have the very, probably the simplest part of communication. We have technical working groups that are very vibrant on Slack. And so there's an extensive discussion and debate around improving technical implementation, whereas you have another group in the ethics space, which responds more readily to an email. And so we're finding somewhat of a disconnect around some of the discussions that are happening. And I think we haven't quite solved this yet, is that how best do you get working groups more aligned with some of the discussions, with the result that we have sometimes the best possible focus discussions across working groups when we have our steering com meetings. Unfortunately, that happens quarterly. And so things tend to fall through the cracks. And as working groups grow, and we probably see this in a range of projects, I think it is making sure that one could keep the proper links. And we've been fortunate that funding that we do receive from the Bill and Melinda Gates Foundation supports a secretariat which attempts to ensure that we can make sure that what is happening between working groups is actually much more aligned. Yeah, I think maybe first stop there. I see there's quite a few questions that are lined up.
Well, not so many, but it's great. Let me just take the last one at the moment. So has the Phage network engaged with the GA4GH passport standard? I think it's GA4GH passports should be useful for you, and it would be a good thing, yeah.
Yes, it is. And I have to admit that discussions have started among specific individuals. I haven't quite followed exactly where it has gone. We've certainly, as we were busy framing our plans for moving forward, I think we are just realizing more and more that there's a lot of work that has already gone into what you guys have been doing in GA4GH, and it really needs to be capitalized on. And so I can certainly see us driving that part much further.
Well, again, I mean, you're extremely welcome to borrow, exploit. You know, GA4GH standards are obviously open, but we'd also, Alan, I think, you know, the people from the Phage working groups coming in and providing use cases and saying this standard doesn't work for us, and this is why. That will be very interesting. So what about the COVID-19 pandemic? Has that changed the willingness to share genomic and pathogen data? And I guess, in particular, from your perspective in Cape Town, South Africa, do you think it's changed things? It's definitely changed things up here in the UK.
Yeah, I think that we have probably got to step back a bit. I think, unfortunately, this narrative is very much focused around the sharing of data. And while there is certainly intent on doing so, I think that often the difficulty we find with people sharing is that there's a lot of requests for people to not think of this as a binary, that you are either going to share because there is a global crisis versus trying to protect certain rights. And so I think becomes a tension. And so certainly in Cape Town, we have seen the sharing of data, but also there's been this hesitancy in doing so in the absence of a policy framework. And this seems to be a refrain more and more. And the challenge that I've seen is that we're in a space where in the midst of a crisis, people are attempting to develop a policy framework. And so it's on the back foot continuously, and there are certainly some stop gaps to sharing, and GA4GH is one. I don't think is necessarily the proper solution, but it's certainly helping in the case of obtaining data for a global need. But what we must realize is that there is a conversation that needs to happen around thinking through what are the mechanisms by which the sharing of data for global good is also nuanced with what does that mean in terms of global benefits. And I think that that is a conversation that is not happening. And unfortunately, it is because of the crisis we find ourselves in. And we've gone already 1 year, 1 year and a half. And so one just wonders at which point do global partners start to take this conversation further, that while we are generating genomic data to understand the prevalence of variants, to understand how the virus is evolving, at some point we are going to have to think through what is the utility of this data for post-COVID-19. And we haven't seen enough discussion around that. And so that for me, I think is going to be a concern moving forward. But not to be pessimistic, I think what this has done, it has reminded us all, and probably more so global politicians, that our health systems are in a crisis. And so if this COVID-19 is certainly catalyzing a renewed focus on how we deal with information, I think that's going to be great.
Okay. So, I mean, I think these two questions kind of sort of goes together. There's are there barriers that Phage is facing that you're looking for partners to help in solving? So I think that's I mean, you've actually described many of the issues already, Alan. So, but maybe with that ask for help, is there anything that you can really see as a gap where you could say, well, if there's someone who wants to put their hand up to do this, that would make a big difference for us?
Yes, I think that what we find, and I think a number of consortia find, is that you get a point where I think that you've got certainly a few key people that are working and that are certainly heavily involved. And I think it is the access to skills. I think it's important. We've been pushing very hard to get a much more broader representation within our working groups. And understandably, that has to be offset by people's current demands within the workplace. And so I think if we just take a few of the working groups that haven't really taken off yet as much, and those are stuff like, or topics like quality control and benchmarking data sets. We know that there are a number of teams that are successfully working in that space. And so I think if we were to look at examples where people could practically get involved, I think it is certainly data integration. In the context of surveillance, is how do we, beyond genomic information, how do we harness information in the social media space? How do we look at clinical information? And it's bringing together, I think there's multiple components. And one in particular is that GA4GH has had a very strong focus on human genomics. And we are certainly going to lean towards a time when, even though our focus a lot is around pathogens in public health, I think this whole interconnectedness of host and pathogen is going to be a critical component. And so we certainly do not have the expertise within Phage necessarily to try and bridge that gap. So I think that's going to be a critical component as well.
I think that's both an infrastructure question, but there's also lots of really interesting research questions there to get into. I mean, I just think it's fascinating. Right, Alan, I think we have to call this a day. You should get to bed, as probably I should as well, given our respective time zones. But it's an absolute pleasure having you on. Thank you so much, and I'm looking forward to Phage and GA4GH growing growing up together. And
Absolutely.
so thanks. And now I think I hand it over to Mark, and Mark, I believe, is in the room. So over to Mark for the panel coming up.